So next we're going to examine for the ulnar nerve. The ulnar nerve supplies, again, like the median nerve, only supplies muscles below the elbow. And the ulnar nerve is primarily a nerve that supplies hand muscles. It does supply a couple of forearm muscles. The first muscle being flexor carpi ulnaris, so have the subject bring his wrist in a ulnar direction, hold it there strong. He's not able to, at least I'm not able to overcome his strength there. Then it supplies the profundus muscles to the little finger and the ring finger. So again, you stabilize the other fingers. Can I have you bring this finger up in flexion? And I'm not able to overcome him there because he's very strong there. Next thing, I test that one. And again, he's very strong there. So those are the extrinsic muscles, and everything else is intrinsic muscles. It's very important to observe the hand because with the ulnar nerve deficit, you often see atrophy in the hypothenar area or sometimes in the first dorsal interosseous, which we don't see in this particular situation. So I usually do a sequential examination for the muscles of the hand for the ulnar nerve. I start with the ADM, abductor digiti minimi, have him bring the finger out in abduction against my finger here, and I'm not able to overcome him. And then next I usually go to the first dorsal interosseous, bring the finger straight up and hold it there strong, and you can see I can't overcome him there. Another way to test interossei, I'll switch to the other side, is to passively extend his fingers with my own and ask him to spread his fingers apart. And now he's using his dorsal interossei to spread his fingers apart, and I'm going to try to overcome them, and I cannot. And then bring the fingers together, and he's using the volar interossei to bring the fingers together in adduction, and I cannot separate them. I cannot force them apart because using strong volar interossei. I then next test the part of the thumb, the thenar area that's supplied by the ulnar nerve, which is really the thumb adduction. So have him bring the thumb up against the palm this way and hold it strong there, please. And I try to push him away, and I can't. If he substituted his flexor pollicis longus because of a weak adductor pollicis, that would be called a Frohman sign. So that's some of the innervation of the hand in terms of the ulnar nerve. One last aspect I'd like to test for is to see for lumbrical muscle function for the little finger and the ring finger. If he had poor lumbricals in these fingers, he would have a claw deformity. He of course doesn't have that, being a normal subject, but to test again the lumbricals, you want to stabilize his MCP and PIP joints and have him just extend at the distal IP joint. Push me away. Good. And do it here. Good. And finally, for the sensory testing of the ulnar nerve supplies the ulnar 1.5 fingers of the hand. So it's going to be all of the little finger and the half of the ring finger, the ulnar half of the ring finger, as well as the hypothenar area and a small area of dorsal distribution in this part of the finger here, of the little finger and the ring finger. So that's the focus examination for the ulnar nerve.